Hello and welcome to the American Council on Exercise live webinar series. Thank you for joining us today. I'm your host, Araceli De Leon. I'm the ACE Product Development Content and Education Manager, and I'm so excited for you to be here with us today. If you are new, thank you for joining us and welcome. If you are returning, you know the drill. We have a couple of quick announcements to share with you before we get started with today's session. If you are an ACE professional, just a quick reminder that there are some free resources available for you, starting with the ACE Job Board, ACE Pro Compass, and the ACE Plus Wix website builder. So be sure to check those out if you haven't done so already. And again, thank you for joining us today. A quick reminder that you are joining us today live via YouTube for free. So again, you are watching today via YouTube for free. If you would like to connect with your fellow attendees, I will be moderating that chat throughout the session today. If you would like to ask questions to our presenter, Dr. Jacque, please be sure to log into your YouTube account or into your Google account to type those questions away. And while you're waiting for the session to start, let us know where you're joining us from. And a couple of common questions that we get asked for our live webinars. Yes, these are free and live. If you are not able to stay with us for the entire hour or have to hop off at any point, a recording of this session will be sent to you to the email that you registered with. In a couple of weeks, though, this session will become available for purchase on the ACE website. If you would like to earn your 0.1 CEC, be sure to purchase this course when it becomes available. And a 10-question quiz will come along with that. Once that quiz is passed, that 0.1 CEC will be awarded to your MyAce account. So again, be sure to let us know where you're joining us from. You're able to rewind at any point and come back and join us live. I will be monitoring those questions and we'll be asking those questions to our presenter at the end of today's session during our Q&A portion. Thank you for joining us, and up next, you'll be hearing from our presenter, Dr. Jacque Crockford.
Welcome to Trauma-Informed Movement, where today we will be talking about how you can create safe and supportive fitness experiences. Before we get started, I'd like to ask you to just do a little bit of a check-in. Not as a health and fitness professional, not as a coach or a business owner, just as a human being. Take a moment to think about a time when you may have had an experience that elicited a response from you that was a little bit more than what you maybe had hoped. Maybe you were really frustrated with a client. Maybe you were having a disagreement with a partner or a friend. Maybe somebody cut you off in traffic and you had a reaction. Take a moment to think of that moment in time and notice if anything about your body has changed. Notice if maybe your shoulders have become a little bit more tense. Perhaps your breath has sharpened. Maybe you clench your jaw like I do when I'm a little bit angry. Notice those body sensations. Now, shifting gears, think of a time when you felt safe, when you felt grounded, maybe even happy. Maybe you were on vacation with your family. Perhaps you were taking a walk in nature, or maybe just drinking some tea while you were reading a book. What's happened in your body now? Has your breath deepened? Maybe you can feel your hands or your jaw relax. Just take a moment to notice any shift that you've experienced. Noticing this shift, going from an activated nervous system, where we were thinking about a time when you were agitated or upset, to a time when you felt a little bit more safe and content. Noticing this shift is the first part, the first step in awareness, and developing that awareness is key in offering safety to your clients as you help to provide those safe movement experiences. Take a look now at this iceberg. This shift that we just noticed was below the surface. And this is where we're going to be talking about today. Those things that happen below the surface within our nervous system. Our nervous system is designed to keep us safe. And when we're going through different things in life, there is much more happening below the surface than what meets the eye, especially when an event occurs that causes us to go into that activated nervous system response. That nervous system response is trauma. As Dr. Gabor Mate says, trauma is not what happens to you, it's what happens inside of you as a result of what happened to you. And this is where we will be focusing on today, the things that are happening below the surface in our nervous system. Hello, it's nice to see you again. My name is Dr. Jacque Crockford. I am the ACE Director of Product Development as well as an ACE Certified Pro. And since about 2017, I have had the honor and privilege of being a trauma-informed movement facilitator within a variety of facilities. This includes inside of correctional facilities as well as inpatient treatment centers for substance abuse. And so today's topic on providing trauma-informed movement sessions is so near and dear to my heart, and I'm excited to share this information with you. Here are today's learning objectives. We are going to be talking about what trauma is and what it is not. We are going to learn how to recognize some common signs of nervous system dysregulation within a fitness setting. We're also going to have an opportunity to think about applying trauma-informed topics and essential pieces of sessions like grounding and finding rhythm with our breath to support nervous system dysregulation within our clients. We're going to hopefully have some time for questions, and you'll be able to also see all of this put together in some brief demos of a trauma-informed movement sequence. So let's get started. What is trauma? The word gets thrown around a lot these days, we know. But as we just saw from Dr. Gabor Mate, trauma is not an event. Trauma is our body's response and specifically our nervous system's response to that event or circumstance that we experience. And according to the National Council for Behavioral Health, nearly 70% of adults do experience a traumatic event at some point in their lives, with 60% of those occurring during childhood. And we know those can have long-lasting effects. So, why is trauma important for you to understand as a health and fitness professional? Well, because with this many people experiencing events and circumstances like this, chances are if you're working with people, you are working with trauma. Something to clarify before we move on, because again, as I said, the word trauma gets thrown around quite a lot. What we are talking about, as I mentioned, is the nervous system's response to an event or circumstance that can cause long-lasting nervous system dysregulation or acute nervous system dysregulation. So when we're talking about trauma, an event doesn't necessarily mean that we will be traumatized by it. Again, this is our nervous system and what it can handle. So we're going to be talking about the ability to cope in just a moment. But remember, trauma is what happens as a result of something, not the thing itself. So before we talk about the nervous system a little bit more, let's talk about what trauma is not. Trauma is not a mental health diagnosis, although it can coexist with one. Those would be something that a client may have received from a mental health provider, a diagnosis perhaps of depression or anxiety. They can coexist if a nervous system is dysregulated, but having a dysregulated nervous system itself is not a mental health diagnosis. Also, trauma is not always a visible experience. Just like we saw in our example of the iceberg, so much is happening below the surface, which is why it's very difficult to know exactly what somebody's going through when they come into our sessions, which is another reason why it's so important to offer these safe spaces, regardless of who or what the client has experienced. Also, trauma is not the same as being stressed, right? We all have a lot going on in our lives, and sometimes, although we may have a dysregulated nervous system as a result of a traumatizing event or circumstance, this is not the same thing as I have a lot going on right now. So keep that in mind when you have clients that come in with energy and have these signs and symptoms that we'll talk about, the difference between being stressed and having experienced a dysregulated nervous system. Also, and I think most importantly, trauma is not something exercise professionals are expected or should ever be treating, right? It's not our job, it's not in our job role, it is outside of our scope of practice, which we'll talk about at the end of today's session. What we can do, and what we'll get into today, is how you can provide safe spaces if someone is dealing with a dysregulated nervous system. And that is our job, always, to provide a safe movement experience. So let's talk a little bit more now about what is happening in the body as it relates to the nervous system. You've probably seen this diagram or a version of it before, but this is our nervous system. Remember, we have our peripheral and our central nervous system that break down from our peripheral system into our autonomic and somatic systems. And then our autonomic nervous system breaks down further into our sympathetic and parasympathetic nervous system. And this is where we're going to be spending a lot more time talking today. And I'd like for you to imagine now, as we talk about the sympathetic and parasympathetic nervous system, that you're jumping out of an airplane. Oh my gosh, right? If you've ever jumped out of an airplane and gone skydiving, hopefully you've got a parachute attached to you. This can be an exhilarating, exciting, and terrifying experience. So this is why I like to use it as an analogy for our sympathetic and parasympathetic nervous system. So imagine you're sitting on the edge of the plane and you see the earth below you, maybe 10,000 feet, and you go, you jump. The first thing that your body will do, and probably has already been doing in preparation for this sensation, is to take a deep inhale. It's the same inhale that we take when we're scared or startled, right? Somebody jumps out and scares us a little bit. We inhale deeply. This is our sympathetic response to this event. The sympathetic response and our inhale of our breath is directly tied to our nervous system. So the other things that are happening, as you can see, our autonomic nervous system just above is responsible for everything that we can't consciously control. Our heart rate, our digestion, gland secretions, right? All of these things have been automatically happening. And when we experience some event or something that startles us or excites us, including exercise or being cut off in traffic or jumping out of an airplane, our sympathetic nervous system is engaged. And I like to pair that and connect that with the inhale of our breath cycle. And we'll get to that reason why in just a little bit. Now, on the other side of that same coin is our parasympathetic nervous system. And if you've jumped out of the airplane, eventually we have to pull the parachute. So when you pull the parachute goes over your head, and you get to float for a moment. And probably what your body does at that time is that long sigh, that exhale, that calming of the nervous system, down regulation. This is our parasympathetic response and our parasympathetic system taking effect. This is the same part of our system that is responsible for things like digestion, things that happen when we are asleep and resting. This is where we are in a more calm state. So if our nervous system is like a volume dial, when the dial is turned all the way up, we are in our sympathetic nervous system state, highly energized, maybe really, really excited, aroused, perhaps upset, or even angered. That's all the way up on the dial, versus all the way down on the dial is that parasympathetic nervous system, calm, digestion, rest, fatigue, depression, right? All of those things are on the same dial volume. So we're going to take this information about our parasympathetic and sympathetic nervous system and relate it to trauma. So here on our next slide, we have, you can see this nice black line, this nice wave that's being created where we have an up and a down, a peak and a valley, and it's this nice, very flowing kind of cycle. And this indicates our sympathetic and parasympathetic nervous system responses on a regular day. Normal day, maybe you're getting ready to go to work, maybe you do drive in traffic and it's a little bit hectic. And maybe you eat breakfast and then you're digesting food. And maybe you have a great meeting where it's exciting, and then you do a workout. And then you come home and you watch some TV, right? And you have this cycle and this nice wave of sympathetic response and parasympathetic response, up and down throughout the day. And as everything is working normally, this dance, this back and forth, this up and down, will continue to happen for us within what's called a range of resilience, which we'll get to in just a moment. But what happens if something interrupts this nice flowing cycle of our sympathetic and parasympathetic nervous system response? Boom. A traumatizing event occurs. Again, this can be anything like circumstances that we are in terms of our life. This could be an event like an accident or a natural disaster or abuse. It could be a variety of things, and it's different for every body. Every body experiences these events differently. But what you can see now is this black line that was nice and fluid, waving along, has now become this erratic, wild red line. And what can happen when an event is traumatizing is we can turn that dial of our sympathetic and parasympathetic nervous system response all the way up, as you can see at the top of our diagram here, for a stuck on nervous system, which is unresolved fight or flight, again, that really high level of sympathetic response, versus a really low, or the dial is stuck off nervous system response, which is unresolved freeze or fawn. Both of these are possible, a dial turned way up or a dial turned way down when we experience a traumatizing event. And we'll learn how to notice the signs and symptoms of this here in just a moment. But let's go back to the other portion of our diagram here, the range of resilience. And this information is from Somatic Experiencing International, a great resource if you're wanting to learn more about trauma and its impact on the body and using somatic experiencing and our somatic nervous system to support healing. But the range of resilience, let's take a look at what this is. Your range of resilience is determined by the nervous system's capacity to complete survival responses and release stored trauma energy, which is influenced by factors like your ability to self-regulate, your awareness of body sensations, and your connection to safety and community. So, in essence, our range of resilience is our ability to cope. We all have a range of resilience, every individual person, and every one of those ranges is slightly different based on these factors mentioned here. Our ability to self-regulate, our awareness of our body sensations, and our connection to safety and community. And so this is what becomes very important for you as a health and fitness professional as you're working with clients, because we have the ability to support them in increasing their range of resilience so that when an event occurs, they are less likely to have a dial that becomes stuck on or stuck off. So let's talk a little bit more now about what this can look like when a nervous system is again stuck on or stuck off in the sympathetic or parasympathetic areas of our nervous system. So here we have some signs and symptoms of nervous system dysregulation, again starting with the stuck on or sympathetic portion of our autonomic nervous system. This can look like difficulty focusing, some kinds of overreaction or maybe a startled response. Remember when you were thinking of the time at the beginning of our session today that you overreacted potentially? Maybe some muscle tension, anxiety and panic, also hyperactivity and hypervigilance, which essentially is a little bit of paranoia, kind of looking around and really feeling unsafe in your environment, as well as rage or anger. So again, this is if our dial is turned way up and we've experienced some kind of event or circumstance that has put us into a sympathetic state of our nervous system for a longer period of time. Versus again, if we are experiencing the other side of that same coin with our parasympathetic response to a traumatizing event. This can look like depression. This can look like dissociation, or meaning disconnection from our own body or disconnection from other people. This can also look like exhaustion and extreme fatigue, also numbness and tingling in our body, as well as sudden withdrawal and just kind of overall disinterest in what's going on. So as you are looking at these signs and symptoms potentially of nervous system dysregulation, let's think about how these might translate to a fitness setting. So maybe you've had a client that's come in to your session and they seem to have a little bit more jittery energy than usual. Maybe they have had too much caffeine, too many cups of coffee already, or this could be a sign of hyperactivity, especially if it's something that you notice on a regular basis. So something to keep in mind. You might have a client who has trouble potentially recognizing and identifying left and right sides during movement. So this can be really interesting, especially if you're in a group fitness setting, which is where I've noticed it as I've worked with the groups that I've had the opportunity to work with. Some people might find it's very easy to put my left foot forward or lift my right knee up. Other times, and for other people, again, maybe on a consistent basis, they have a hard time identifying which side they want or should be moving with. So just something to note, as this could be one of those signs of dissociation from their own body. Next, we have not unmotivated, or this could be a symptom of withdrawal. Again, hopefully you've worked with your clients to help them in developing the program that you're working with them on, whether that's a health coaching scenario or personal training. So if they've worked with you on this program, hopefully they're excited about it and they are excited to come in and work with you and reach their goals that they've established. But if they become unmotivated and really are just not interested in the program that you've developed together, this may be a symptom of withdrawal. Next, we have unexplained pain. And this, I'm sure you've seen manifest in your experience as a health and exercise professional, because we know that the nervous system is inextricably linked to our myofascial system. So if you have a client who has been doing all the foam rolling and they've been doing all their warm-ups and they're stretching at the end and they've been getting the massages and they've been doing all of the work, yet they still have unresolved or unexplained pain and tenderness in their body, something to keep in mind, as this could be a symptom of having an overactive nervous system and having unresolved energy through their body. Next, we have short-tempered. If somebody comes in again and they're exhibiting some rage and some anger that is unusual, or perhaps they just kind of always show up with kind of that mean mug on, this could be a symptom of having, again, that dysregulated nervous system. So something to consider as you're working with them. It may not be their personality. It may be a result of something they've experienced in their life. Next, and probably have all seen this at some point, so there's a lot of factors that could be at play here, but decreased performance, which is a result of fatigue. So if we're overly fatigued and we have that nervous system and the dial has been turned all the way down, this could be a symptom of a dysregulated nervous system. So, as we've been going through these signs and symptoms and relating them to a fitness experience or a fitness session, have you had a client in mind? Somebody that you've been thinking of? Maybe you have a couple group fitness members or participants that, oh yeah, I've seen them do this, or a client that you've been working with for a long time and noticed some of these ring true for them. I'd like for you to keep those people or that person in your mind now. And before I switch to the next slide, where I'll be reading a quote for you to consider, as you think about this person, I'd like for you to monitor and notice any changes or shifts in your own body as I read our next quote. Trauma, decontextualized in a person over time, can look like personality. Trauma, decontextualized in a family over time, can look like family traits. And trauma, decontextualized in a people over time, can look like culture. So maybe sit with this for a moment. And again, if you're thinking of a client or a person that you've worked with in your career as a health and exercise professional, notice if you might think about them a little differently now. Maybe notice if your body had any response to this quote. Feel free to jot down any reflections on your own or maybe into our live chat right now. This quote comes from My Grandmother's Hands by Resmaa Menaker. It's a great resource, especially if you're working with groups. There's a lot of great tools to use so that you can support different types of people potentially working through dysregulated nervous systems. Okay, now that we have some background and we can start to identify signs and symptoms of a dysregulated nervous system, let's talk about how you, as a health and fitness professional, can use this information and create these safe, trauma-informed movement experiences. There's a few key aspects of designing trauma-informed sessions. So first, we want to start with building in autonomy by providing options and modifications. Now remember, the trauma that we're talking about here is the nervous system's response to an event. And generally what makes that a traumatizing event for someone and sends our nervous system into that dysregulation outside of our range of resilience is because we lost autonomy. We weren't given the choice as to what was happening to us in that moment or moments. So we want to give that back to our clients by providing options, different options for movement by way of range of motion, speed, direction, and any modifications that they might need in order to feel safe in their bodies. So one way to do this is by saying, here are 2 options for this next exercise. Which one of these feels best for you to try today? And let them choose. Next, we want to encourage pacing, which means allowing for rest without stigmatization. If your client has 30 seconds left of something and they decide to take a break, there was a reason for that. So instead of using their choice to take a break to demoralize them or to make them feel bad about taking a break, say this: well done listening to your body. Tell me, can you identify the sensation that let you know it was time to stop? Again, this gives them the opportunity to become aware of those body sensations that are so important in increasing that range of resilience. So allow them to pace themselves and rest as they need. Next, we want to use language that is inclusive and invitational. I've already been doing this a little bit throughout our session today, but this sounds like you might try, or perhaps see how it feels if, versus put your feet here and do this, right? That's very different. It gives the client some options again and allows them to choose what they would like to do. And language is a very easy way for us to slide that in to our sessions. And next, another key component of designing trauma-informed sessions is to create structure. Again, because something ends up as traumatizing to our nervous system, part of the reason why is because we didn't know what was happening and we didn't have the option to choose any part of that. And so if we can create structure and give that information to our clients as to what is going to be happening, this helps them to feel safe with us and within the setting that we are in. So this means being predictable in your sessions with them while also allowing for some flexibility. And I want to make one caveat here and just kind of call out all of our group fitness instructors. I know I have done this myself as a group fitness instructor, so I own this as well. When you are counting down for 5, 4, 3, 2, 1.5, 1 1/4, right? And you elongate those last bits of challenge or those last bits of work for, any kind of set that you're working through with your group. I've seen this happen so often, and when we do that, it can be very dysregulating to a nervous system because it feels like they can't trust that this is all I have left to do. So, an opportunity and an option for you to consider is, if you'd like 5 more counts of the plank that you're holding as a group, count down from 5, 4, 3, 2, 1, and then give them the option of 5 or 10 more seconds on their own so that they can take that choice and that autonomy and that option back and choose what they would like to do. So creating this structure, providing some predictability by maybe allowing for the warm-up to be in the same section of the gym every time, maybe giving them the layout of the land as far as what you're going to work through in the workout today, and then providing a similar or very predictable structure for the cool down, things like that. Create that structure again and provide safe experiences. Now, let's go through a few things that you can do in your sessions once you've included all of these key features that you can do so that you can provide these safe experiences. And this information comes from Dr. Arielle Schwartz, and she is an amazing resource and works with an organization called the Embodied Lab to provide education on supporting clients through trauma healing. And so I invite you to look into her information as well. These steps are very easily relatable to any movement experience. So the first thing we want to do is grounding. And grounding essentially is to bring people back into the present moment. Let them know that where they are is a good place to be. So this might look like having someone notice their feet on the ground. It might be asking your client to feel the weight and the handle of the weight in their hand. Or it might be as simple as asking them to take a few breaths before moving into the next set. So just grounding within their body and letting them know this is where you are and you are safe here. Next, we want to orientate to the space. Once we have become safe in our bodies, we want to be safe in the environment that we're in. And especially if someone has experienced a traumatizing event that was an unsafe situation, right? And so giving them that safety back, letting them know that if you're in the gym, maybe looking around the room and identifying 3 colors that you see. Or noticing if you can hear 2 things inside the space that you're in now. This lets us know that the space that we're in is a safe space, and it's not where something bad happened or wasn't where something occurred previously. So next, after we've orientated to the space, we also want to create rhythm. Very easy to do within a movement experience. We do it all the time, right? But we want to create rhythm, and we want to create an opportunity for rhythm with our breath. Remember, we talked about the sympathetic and parasympathetic nervous system being the inhale and the exhale of the breath. And when we move rhythmically between the inhale and exhale of our breath, that gives our body the opportunity to practice in a safe space, going up and down in that nice wave within our range of resilience. So we want to add rhythm into all of our sessions. We also want to offer options. Like we mentioned before, this is a way of giving autonomy back to our clients and helping them to feel safe in their bodies and safe in the session. And lastly, and probably most importantly, we always want to respect consent and client boundaries. I hope I don't have to say this, but I will. Just because you have received consent one time to support your client with some kind of physical touch, whether it's a stretch or a spot or something, does not mean that is a blanket consent. So please ask your clients every time, read the room, ask the questions, and always respect their response. All right, I would be remiss if I didn't bring our ACE ABC approach into our conversation today. Remember, our ACE ABC approach is a component of our ACE mover method, which is our ACE behavior change approach. So this is 3 things that you can always remember to do so that you are providing these trauma-informed movement sessions. So A, stands for asking open-ended questions. And feel free as we go through here, if you'd like to type in your open-ended questions or any other part of our ABC approach, go ahead and type those in, and it'll probably help your other pros who are watching and listening today, or jot them down so that you can use these with your clients later. So again, A is asking open-ended questions, and one way to help assess without judgment how our clients are feeling is by asking, if your body could talk today, what would it say? Right? Sometimes you might get a, I'm good, or sometimes you might get a, low back is feeling really tight, I don't know why, and I've just felt really kind of over it this week, right? You might get a little bit more information through this open-ended question. So feel free to type in another open-ended question to assess without judgment how your clients are feeling in their body, what they might be noticing about their body when you meet with them. B is breaking down barriers. Remember, breaking down barriers means we're trying to explore what maybe hasn't worked well for our clients in the past and how we can move past that together. So, one open-ended question that we can ask here is, are there any movements or positions that don't feel right for you today, or that you would prefer to just avoid altogether? So, that might give your client an opportunity to say, actually, I would really not like to do burpees at all. Or I really don't feel like reaching over my head, my shoulder's been kind of tight, and I slept funny, right? May have nothing to do with a dysregulated nervous system, but it is a great opportunity for you to help them move forward and feel safe in doing so. And last, our C from the ABC approach is collaboration. We always want to work together with our clients and support them in reaching their goals. So you can ask, how would you like to modify this session to make it more enjoyable or beneficial for you today? So feel free to use this ABC approach. Again, you can type in some questions that might work for you and share those with your fellow pros. Okay, we are ready to do a little bit of a guided practice, and I hope you can join me for this, and we're going to put together some of the tools that we've been talking about today so that you can provide some safe movement experiences. These are just tiny snippets, tiny examples of how it might look to be coming at movement from a trauma-informed lens, and you can use them at any point during a session with a client. This could be at the beginning when you first meet with them. This could be throughout the warm-up, maybe even in between sets of the main part of your workout, and as part of your cool down. So to help us demonstrate, I'm going to have Araceli come in. She is going to be our client today. Thank you for being here. And again, you can do this on your own at home. Join us and pretend that you are the client as well. And we're going to come at this from two different directions. So remember, we had the sides of the same coin, our parasympathetic being the volume turned all the way down, and our sympathetic response, the volume turned all the way up. And so to start, we're going to maybe see if Araceli, if she's been a client that has a volume knob turned all the way up, maybe she's exhibiting some of those signs of having a sympathetic response to her nervous system. Maybe she's feeling a little jittery today, or a little bit kind of all over the place, and you notice that you'd like to do a nervous system check-in with her. So follow along. Araceli, would you want to, before we get to the main portion of our workout today, would you want to do just a little nervous system check-in with me so we can move forward with our workout?
Yeah, that sounds great.
Awesome. Okay, great. So feel free, just as you are, you can be standing, or if you feel comfortable to sit down. If you're at home watching, feel free to sit down and do this. Just start shaking your hands, shaking your arms, starting to move some of that energy around just a little bit. Notice if you want to shake a little bit harder or lighter. Sometimes I like to pretend that I'm flicking water off of the ends of my fingertips. You might notice how it feels to move your shoulders a little bit more. If that feels interesting, just sort of shifting some energy around here. If you want to start to move your feet or sway at all, that's an option. Maybe starting to notice your breath as well. All right, so we're working on discharging some of that energy that she might have been coming in with, and now we want to provide a little bit of rhythm. So if you'd like to, Araceli, option here might be to reach your arms in front of you or maybe out to the side, whatever feels comfortable in your shoulders today, and maybe take an inhale as your arms come up, and then as your arms come down, maybe just allowing an exhale. And you can bend your knees or sway back and forth, whatever your body feels like it wants to do here. We're just inviting a little bit of rhythm with our breath. So you can start to move your arms in any way that you'd like, maybe reaching up higher or lower or out to the sides. And you might also start to bend your knees a little bit more if that feels like it might be interesting. So reaching up, reaching down, again, just finding some rhythm. And your choice here, if you want to move a little faster or slower, you can reach up and exhale down and reach up and exhale down. But again, you get to choose. So there's no right or wrong way to move. As you work through this, we're just, again, checking in with the nervous system, finding a little bit of rhythm here. And whenever you feel like it, Araceli, you can just kind of come to a stop, come to a rest, or anything that feels like kind of neutral. Maybe shake and shift as much as you need. Just kind of settle back in. And now, invitation to look down at your feet and just notice your feet. You can shift them around, maybe shift your weight forward or shift your weight back. Any sensations that you might be noticing there in your feet or your toes or your heels. Nice. And then lastly, to check in, I'll ask you to look around the room and see if you can notice 3 colors. And if you're at home, you can look around your space, see if you can notice 3 colors. And then maybe take a breath. How do you feel?
Great.
Good.
Yeah. Thank you.
Nice. Okay, so remember, that was just a little sample of how to integrate some trauma-informed movement with a client who might have come in with that dial turned a little bit up. So sympathetic nervous system response, some jittery energy, hyperactivity, things like that. Now, we'll pretend that Araceli has a nervous system response that might be much lower than that. So maybe showing some disinterest, maybe a little dismotivation, fatigue, things like that. So what we want to do here is re-engage the body and sort of reinvigorate the nervous system to turn that dial up just a little bit higher. Okay, Araceli, before we get started today, would it be okay if we went through just a nervous system check-in?
Yeah, sure.
Okay, great. So what I might ask you to do is just look around the space that we're in here today and see if you can notice 3 new objects. Maybe something that you haven't noticed before. Again, you can try this at home. 3 objects, maybe identify them, pick them out. Here we are in our studio. And then from here, we'll start to create just a little bit of rhythm. So I might ask you to take one hand, it doesn't matter which hand, and see how it feels to press that hand across your body, maybe turning with it as much as feels comfortable. And then we'll switch to the other hand. So just pushing across. If you want to bend your knees or find some rotation, again, whatever feels right for you. It's just a nervous system check-in, so we're not really concerned about what the movement looks like. Maybe just noticing what it feels like in your body today. If you want to push up or push down or push across, push over. And you might notice as well, maybe take an opportunity to see if you can breathe with this motion. So an inhale somewhere that feels good, and then followed by an exhale. What we're also doing here by crossing the midline of our body is connecting our two brain hemispheres, and this also helps with kind of recalibrating the nervous system response. So continuing with the motion, whatever motion feels right, speed, tempo, range, right? And then just shaking it out when you feel done. And then lastly, we might see how it feels. So just cross your arms over your chest and maybe do a little bit of self-massage on your shoulders. Notice if that feels nice. You're welcome to move down your arms, or maybe find just a little bit of swiping down the length of your arms. So here we're providing an opportunity for Araceli to feel her own body through what's called havening touch. And this is a way for her, again, to re-engage with her body, re-engage with her nervous system, and feel just a little bit more energized. How do you feel?
Great.
Good?
Yeah, thank you.
All right. So she's ready, and then we would go on to the rest of our exercises for the day. Thanks, Araceli.
Thanks, Jackie.
All right, hopefully you enjoyed working through that practice together. Lastly today, before we end our session, I would be remiss if I didn't talk about the role that you have as an exercise professional as well as your scope of practice. So remember, it is always essential to be within your scope of practice as an ACE, health, and exercise professional, which likely is not as a trauma therapist, unless of course you have those additional credentials, which is amazing. We as exercise professionals are facilitators of safe movement. We can provide safe movement opportunities, not trauma counseling, which is why it is so important to refer out when necessary. Hopefully you have a list of other mental health providers and other counselors and therapists that you can refer clients to. Always use those very liberally, I think is really appropriate, because you want to stay in your scope of practice while also letting your clients know that you're still supporting them, right? So we build this trust, we build this rapport with our clients through consistently offering these safe spaces, not through counseling or through therapy. A few key takeaways as we end our time together today. Remember that trauma is a nervous system response. It is not a diagnosis. Hopefully today was helpful in supporting you in noticing some signs and symptoms of nervous system dysregulation. We use things like grounding and offering options and choice to support our clients through what could be nervous system dysregulation. And again, we always want to stay within our scope of practice to create these safe and empowering environments. I want to leave you today with a few references. These were included in our presentation today, as well as some resources. And I want to draw your attention to the second to last bullet on this slide, which is the book, The Body Keeps the Score by Dr. Vessel Vanderkolt. So please take a look at that resource. It's an amazing book, especially if you're a science nerd like me, to understand how trauma impacts the physical body. Here is my contact information. I'm so excited to stay in touch with you and talk with you more about what you learned today and how you're applying it into your sessions with your clients. Feel free to connect with me on LinkedIn or at Dr. Jack's Fitness on Instagram. Once again, thank you so much for joining me for this session on trauma-informed movement. Hopefully you feel empowered to create safe and supportive fitness experiences for all of your clients.
Awesome, thank you so much, Jackie. And here on your screen, you can see when this recorded course or this webinar becomes a recorded course on our ACE website, how to purchase that and obtain that 0.1 CEC in your My ACE account. And if you enjoyed today's topic and would like to learn more, there are already some courses available for you with our embodied stress release, our holistic wellness course, and our mental well-being certification. So be sure to check those out as well. And let's get into some questions. I know there's been quite a bit of chatter and communication in the chat so far. So Jackie, thank you so much for walking me through that.
Yeah.
You feel it immediately in your body. Once you start to move around, you immediately just, for me, I chilled out a bit, and that felt really, really good.
Yeah.
So thank you for walking me through those exercises.
You're welcome. You're welcome. That's kind of the key aspect of it, is to just notice and just feel. I think, as I mentioned, we were going through that. It doesn't matter what the movements look like. That's not really what we're after. We can concentrate on the proper form, when we do our squats and things like that, but to provide some opportunity again for somebody just to move in whatever way they feel like they want to is really important for providing that re-engagement and regulation of the nervous system.
Yeah, it felt great, and it's so simple.
Yeah.
Right? We did that for a couple of minutes, and it was great. Some questions that we've been getting from our pros here. Can you have both an on and off system at the same time?
Yeah, that's a great question. I'm so glad that somebody asked that, because it can feel like, oh my gosh, what's going on, right? So sometimes what can happen, and again, every body is different. We're talking about nervous system response. So every body is going to respond differently. What can happen is we can go very quickly from all the way on to all the way off. They're typically not happening at the same time exactly, but it can feel almost simultaneous, or it can appear as almost simultaneous because of how quickly our body makes that shift. So it is the nervous system's response, sympathetic or parasympathetic, right? The dial turned higher up or lower down, and they're not simultaneous, but they can feel and sort of appear that way because we can make that shift pretty quickly in our bodies.
Yeah, thank you. And perfect examples are clients coming in from a lot of traffic, they get to the gym, they're hyper aroused, and then they, go, it shifts a lot, definitely.
Yeah. And again, we're doing that shift all day long, right? When we talked about the range of resilience and that nice wave, that shift is happening regularly in our bodies. The issue is when we get stuck on a really high level or a really, really low level of that wave.
Awesome, thank you. And how might this relate to burnout or hyperarousal that may lead to depressive symptoms, or does it lead to depressive symptoms? So just that relationship between burnout for folks.
Yeah, so one thing I want to mention for myself, I'm not a mental health professional. I am an ACE certified professional, and I've gone through a lot of trainings and have different certifications in trauma-informed movement. But to be diagnosed with depression, again, is a mental health professional's role, and so we want to leave that in that space. But in terms of burnout, that comes from stress, right? That comes from long-term stress. And so we can work and use these same tools. Remember, stress isn't the same as experiencing a traumatic event, but we can use these same tools to support regulation of our nervous system to maybe prevent burnout from happening. But again, we have to manage our stress as well in a variety of ways, not just through these types of movement sessions.
Yeah, and I see a lot of folks in the chat are, saying this is very true, this is how they also have seen their experience with clients as well. Let's see, with regards with dysregulation, apart from the input that you already provided for group fitness instructors, is there anything for diverse populations or different populations, like older active adults who might come in that are slower to move or slower to kind of come up from, need less grounding, for example, or more grounding?
So yeah, every body is different, and so it really takes skill and awareness as for you as the health and fitness professional to just be noticing how your clients are coming in. Medications can also play a role here. We know that certain medications and certain illnesses and diagnoses as people get older, I'm thinking of Parkinson's, right? When people do have very visible symptoms of shakiness and jitteriness, that we know is very different than somebody just kind of wanting to bounce their leg all the time and be a little bit jittery and higher energy. So taking all of that information in with regard to each individual client is just going to be really helpful in helping you to understand what's going to work for them. And it is a lot of trial and error. There is no, as I said with the movements, there's no right or wrong way to move. As long as you are offering these options, offering autonomy and choice, using language that's invitational and not using that pacing without stigmatizing them, like all of those things we talked about, as long as you're doing that, you're working to provide the safe space regardless of, maybe what the client individually has going on.
Excellent. And in that same vein, we have a final question here that we have time for those clients that are self-conscious and you have that conversation with them, or maybe you do notice some signs of their systems being on or off, or stuck in that on or off state, and you can tell they're a little bit more self-conscious. Any tips for that, especially for the folks that do work in more open settings?
Yeah, that's a great question. And I would take that back to our ACE ABC approach. Ask those open-ended questions, work with them to break down barriers by understanding what has and hasn't worked in the past, and collaborate with them on what is going to work moving forward. Maybe the answers to those questions will surprise you. They might, because we want to give our clients the opportunity to share with us what they feel comfortable. Remember, if somebody's experienced a traumatizing event, the event itself does not matter. We do not need to know what happened to them in order to support them. So we're not asking questions about, why are you like this and what happened to you? We're asking questions about how we can support them in feeling safe. And you can do that with that ABC approach that we talked about today.
So beautifully put. And thank you, everybody. Thank you again, Jackie, for sharing your expertise and your insights with us today. Again, just some quick reminders here that you do have some free resources available to you, so be sure to check those out. But last but not least, we are so excited to announce the upcoming ACE Health and Fitness Summit, smarter program design for everybody. You do not want to miss it. This is part of our professional conduct and ethics, so if you do need that still for your renewal, this is already part of it. And if you're an ACE Power Pass holder or CEC Power Pass holder, this is part of your membership. And this is happening on Friday, November 14th. It is an all-day event worth 0.5 CEC, so be sure to check that out. And continue to connect with us, and let's get people moving.